We're back with Dr. Adami from Florida. Dr. Adami, tell me, what city was that again? You're in it?
We're in Delray Beach.
All right.
Delray
Beach. Now, tell me, you know, people talk a lot about periodontal disease, gum disease, gingivitis, periodontists, periodontitis, whatever, all those, you know, $5 words, which most of us cannot even pronounce. I at least can't. Anyway, can you tell us what's the difference? What is what? You know, and what are the consequences of if we get one or the other one?
Well, at the very first start of the disease, it's called gingivitis. And gingivitis is nothing more than inflammation, a red inflammation of just the gums. And that inflammation normally occurs because there's bacteria allowed to live around the gum line long enough to cause the gum to turn red. If that bacteria stays there long enough, it'll penetrate down between the gum and the tooth, and it'll start to affect the bone. Once it affects the bone, it's called periodontitis. It's the next stage of the same disease. If the periodontitis stays long enough, the bone will just melt away, and you'll wind up with a loose tooth, and the tooth can fall out in your soup. That's a very common thing to have happen.
All right. Now, so periodontitis, gum disease, same thing, just a more layman's name, or what?
It's the same disease, but the periodontitis is a more progressed version of it. It's more advanced disease. But it all starts out with bacteria around the gum line that's left there too long. If you don't brush it and floss it off and have your hygienist see a hygienist every 4 to 6 months, that bacteria will just hide in those nooks and crannies, and it'll cause the gum to get real red, and it'll affect the bone as well. And once it affects the bone, you can get all kinds of infections and wind up losing the tooth and all sorts of bad stuff.
And then we're back to needing implants and all kinds of stuff.
That's exactly right.
Now, one thing here, you keep mentioning the word infection. And I've read a bunch of things. So number one, I mean, the tooth loss is obviously not something you want because, as you just said, if you lose your teeth and you don't replace it with implants, basically your face will cave in, so you look old. However, one thing at least is nice about it is you dentists have advanced extremely far, and you can replace teeth to make it look and feel natural. And it's not the biggest deal in the world anymore, as long as you're willing to spend a few grand.
That's correct.
And, of course, who wants to give a few grand to a dentist instead of going to Disneyland if you don't have to? You know what I'm saying?
That's very true.
Now, however, something which I think must be equal, if not more, as devastating. Now, when you have an infection in an area of your mouth which seems to be the gateway of your blood vessels, because, you know, take salt or take any certain tablets, something which needs to go in your body fast. If you want to revive a body who is like getting unconscious, you do something and put it under his tongue because it goes zoom. Am I right?
That's very right. Correct.
So if in that body part you have an infection, you know that yellow, ugly, reddish pus which comes out when you cut yourself, you know, where? Well, wouldn't that travel to your brain, to your heart, to your liver, it basically go into your whole blood very, very fast?
It certainly can, and we now know that it can and does go to those places. There have been many, many studies in the very recent past that have isolated the same bacteria from the mouth in the heart vessels, and it has been shown to be the start of basically cardiac disease, and which can cause heart attacks. It's also been shown to be in diabetics. It can contribute to diabetes, to low birth weight children. There's a whole host of diseases that we are now linking to the same bacteria that starts out in the mouth, which makes sense if you think about it. As you had mentioned, the mouth is the first entry to the body, and there's no reason to think that what's in the mouth does not wind up in other places of your body.
No, of course not. Absolutely. Now, in fact, you mentioned low birth rates in babies. I mean, so basically, any lady who is thinking of being pregnant should pay extra attention of having a extremely infection-free mouth, which means get the cleaning, get the get that dirt, that chicken under the carpet, so to say, scraped out.
Mm-hmm.
Now,
and
fact,
brush and floss regularly.
Yeah. In fact, in California, there was one lady who had a stillborn baby, and they found gum disease infection in her placenta. That's obviously an extreme case, and I think is only one case known as such. But if that can happen and low birth rate can happen, what about the everyday immune system? It must be lowered when the next flu season comes, which is always coming, doesn't matter where in the country you are.
That is very true. That having to fight the infection that's in your bloodstream from your mouth does basically keep your immune system from attacking other enemies that it can only handle easily, like the flu, like the cold virus, tuberculosis. So there's all kinds of things that your immune system fights every single day. And if it's preoccupied fighting the infection from your mouth, it can lead to you being one sick person.
Well, so it looks to me that the tooth floss, of course, is the end result, but not necessarily the worst result. It may be it may be an expensive result and visible, and you start looking bad and, of course, smelling bad and all kinds of things, and self-confidence goes down. I mean, who wants to have a self-confidence down while it is happening? But it looks to me that that may be easily a process of like 2, 3, 6 years going on, if not fixed by a dentist, that for 4, 5, 6 years having an infection keep going on and being fed constantly, not like you get one infection, you get it in, the body fixes it and it overcame it and it's fine because there's no more source of new infection. But when you have an infection in your mouth and you don't fix it, it's a continuous stream of infection reaching your body.
It very much is. When these infections settle in the bone of the mouth, your immune system can handle it for a while, but it's like a seesaw battle between the infection and your immune system. And there are times when the infection really gains strength and can really spread. That's the days when I get the phone call that someone has a big swelling that they didn't have yesterday, so yes, those infections can last for years, and they can sometimes lay dormant until something in your immune system weakens, and then all of a sudden the infection gains some strength, and you're in big trouble.
Well, I think we need to end this interview because I think I just realized I should go and check my mouth for infections with a dentist. So bye-bye, Dr. Adami.
Very, very well.